How safe is our practice? How do we make sure patients we work with are safe? How could we prevent a serious incident occurring? We recognize that we work in a high-pressured, high-risk environment, and that even with the best risk management policies and procedures, we cannot make everything safe. However, we also know that if we consider human factors, that is, the interaction between people and systems, we can reduce the likelihood of harm occurring. For example, being aware of and acting on processes and environments that increase risk and sticking to basic principles of good practice can help. We reviewed 40 series over the past year, and we found that there were repeating themes. We've used some real examples in this film. Let's take a simple model known as the Swiss cheese model, developed by Professor James Reason, and think about how this can help ensure our practices are as safe as they can be. Each slice of cheese is a protective factor, which can reduce the likelihood of an incident occurring, and the holes in the cheese are the errors or gaps in expected practice. We already have protective factors in place to prevent incidents, but we need to ensure these are working effectively. Let's look at what we know are protective factors. Workload management. Knowing and effectively managing our workload. Are we using management, professional and clinical supervision, and other support? And do we know how to raise concerns? Are we seeing the right people and in line with assessed need? Are we discharging people at the right time? And are we being proactive? For example, dealing with situations where there is a problem or no progress. Information. Do we have all the information we need? Is it up to date and accurate? For example, have we fully considered service user views, carer or family views, results and previous assessments? Analysis. Do we know enough to analyze the information, formulate or contribute to a team formulation? Analysis includes knowledge of theory, research evidence, guidance and best practice. Care planning. Effective care planning relies on sound information and analysis. There should be a clear thread from the assessment through formulation to any plan. Care planning must be executed in partnership with patients through a process of shared decision-making. Communication underpins everything. This incorporates effective verbal communication with patients, family, carers and the team. It also means accurate and timely record keeping. Any other relevant professional should be able to pick up the patient record, understand the plan, understand why decisions have been made, and continue with support and treatment effectively in our absence. Now let's apply this to a specific scenario to see how a serious incident can happen when there are errors and omissions. Let's consider the following example of a 23-year-old man who has a diagnosis of schizophrenia. He lives alone, is mistrusting of care staff, and has a history of self-harm. A. The practitioner was having difficulty with the emotional impact of working with the service user. This was not discussed in management supervision, and they did not access clinical or professional supervision. B. The young man attempted to jump off a bridge this time last year. It is a special anniversary. His family recognize he is becoming low when he stops taking his medication and isolates himself. C. A risk formulation was not completed, so there was no comprehensive analysis of the interaction of circumstances, risk, and protective factors. D. Care planning without full completion of the health and social care assessment. E. How the family interact with the service user was not recorded or communicated to the team. Is there an unknown agenda? For example, no other home to go to if the client has to move. Because of these various errors and omissions, because the holes line up, we are now dealing with a serious incident. Now, let's look at how, by getting the basics right and by making small, incremental changes, we can minimize or even eliminate errors, and so prevent serious incidents occurring. If there are no holes or smaller holes in the cheese, this means that we've reduced or eliminated the likelihood of errors, and a potential incident is prevented. If an error or omission does occur in the first slice, perhaps due to a patient service user missing or failing to attend an appointment, or another factor out of your control, the next slice or protective factor again stops the incident from progressing. In this way, we can see that the arrow could feasibly pass through 4 layers, but still be stopped at the last layer. This would be an unusual coincidence of unforeseen or uncontrollable incidents. But as long as the protective factors are properly in place, we could still avoid serious incident. We all try to get things right, but we should also recognize occasionally we can all make mistakes too. It is not necessarily about making big alterations to our practice, but rather small, incremental changes that add up to the larger positive outcomes. It's about sticking to the basic principles of good practice. If we all do this, we can dramatically reduce the likelihood of harm occurring. With this in mind, how safe is our practice? What things can we do today to eliminate or reduce the size of the holes in the cheese, the errors or omissions in our practice?